The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Breast cancer is the most common cancer in women worldwide, and just behind skin cancer for women in the U.S. Here for Breast Cancer Awareness Month to share how advancements in detection and treatment mean more women are surviving a diagnosis, we welcome Providence breast cancer oncologist Alison Conlin. Good to have you back again.
Thanks for having me.
Going right into it, when do you think women should start getting screenings for mammograms or getting mammograms?
There's been some confusing messaging out there
Yeah.
over the last many decades, it feels like.
Sure.
And so, you know, we were at 50, we were at 40, we were at 45. I think we're back down to 40. I think 40 is the right timing for screening, or at least engaging with your primary person about what about me, and that's for the average risk woman.
And mammograms really are, seems to me, the most common way to detect breast cancer. Oftentimes, like, manual doesn't work, right?
Right. So yeah, mammogram's a great way to detect something that's really small that you can't feel. Of course, if you feel something, you should go to your clinician and say, should I get something else? But yeah, if you're just feeling fine, you still need a mammogram.
Yeah, absolutely. So what are some lifestyle choices or family history that might impact whether you end up with breast cancer or not?
Yeah, I mean, so we know a lot about sort of the other factors that relate to who gets breast cancer. It is the most common cancer in women after non-melanomatous skin cancers, but certainly your family history matters. That said, most people don't have a family reason to get it. So it's sort of, if you don't have a family history, you still are at risk. Gaining weight after menopause, it's a hard one, but it does increase our risk. Exercise is a great preventative one. So if you get some good regular exercise, hopefully you're at lower risk. So it's really just being a woman.
Well, that's the risk right there, because it seems like when I've read studies that from you guys, the idea that family history plays a role, yes, but the vast majority of women who get breast cancer had no family history.
Exactly. So you're not really safe if you don't have a family history.
Exactly. Let's talk about treatment. And it seems like, maybe I'm wrong, but almost every 5 years, the treatment changes just a little, or for each person, it's different.
Yeah, it's become a lot more personalized.
Yeah.
So we used to think about it as the person, how old they are, who they are. Now we really think about it as the cancer. So we're doing so many more genomic analyses on the cancer and doing less to women. We're trying to have less radiation, shorter radiation. People don't have to all do it. Less surgery if we can do it, less chemo. But in the same respect, for some more aggressive cancers, maybe more chemo or different chemo. So it's really, the paths have diverged, and it's really important to know, you know, what kind of breast cancer. It's not all the same.
Right.
So it's become quite personalized.
And it's changed over the course of your career even, hasn't it?
Absolutely.
Yeah.
It's kind of incredible to see doing less to some women, doing more to some women, having new drugs. We have a new drug approved every single year in breast cancer.
So talk to me about some of the new technologies out there and drugs out there.
Yeah, I mean, we're very excited about some of the new drugs coming. We have new oral endocrine therapies that are just on the horizon, so different than the usual pill of Arimidex or tamoxifen. We have new targeted therapies, all these antibody drug conjugates. They're sort of smart bomb ways of delivering chemotherapy. It just feels like every year we have a new treatment that's more targeted towards the cancer, so that, you know, we have more women having cures.
And did I read somewhere that the idea of losing your hair during chemo, there may be more advancements in that direction?
Yeah, hair-saving technology. It's actually pretty routine for women to get that. There are still some drugs that it's very hard for women to do that with, but there's a lot of our regimens we give where you can use a cold cap on your head and not lose all your hair, which makes kind of living out in the world a lot more normal.
Yeah, I know when I had been diagnosed with breast cancer, I thought there's no way I could do losing my hair. It's a big thing for women.
It's just everybody gets to know what you're doing. You'd rather have it be more personal and just have you and the people you want to share with now.
Very true. It's interesting to see that women with stage 4 breast cancer are living longer.
Yeah. Survivors in their own right. So we have so many great treatments that they can be on therapy and live for a very long time with as good quality of life as we can give them. So they want to know, they want you to know, we're out there and we're living. This isn't something that's a death sentence for us either.
So it can be managed, like we're thinking it's a chronic condition, but can be managed?
We're trying to keep it a chronic condition. For many women, they can live for many years. Obviously, there are still some very hard cases where people have a more aggressive tumor, but for a long time, they're out there living. We say, you know, you're going to come in, you're going to get your treatments, but you're going to go out and still do all the things that you love in your life.
And aren't there clinical trials that women are taking part in that you feel really hopeful about?
Absolutely. We have a really great set of clinical trials, always trying to advance our science, offer new medicines to women, new combinations of things. Immunotherapy, haven't really touched on that, but that's a huge field in breast cancer, trying to figure out how can we train our own immune system to fight the cancer. So it's always a great idea to say, you know, is there a clinical trial for what I'm doing, or is the standard the best thing?
Wow, this is amazing, absolutely amazing. We want to tell folks, if you would like to find out more about breast cancer treatment or care, just contact Providence Cancer Institute. We're going to put the information for you on our website at k2.com/familymatters. Thank you so much,
Thanks
Doctor.
for having me
Appreciate
today.
And thanks for the work you do, too.